Unmasking the stereotypes, health choices through a skewed lens. We often hear about the stark differences in health outcomes between the rich and the poor. Stereotypes emerge, painting a picture of the affluent engaging in healthy habits, while the less privileged make detrimental lifestyle choices. We see images of well-to-do families enjoying fresh produce, while those struggling financially reach for fast food and cigarettes. These oversimplifications, while seemingly straightforward, fail to capture the intricate web of factors that contribute to these disparities. This simplistic view ignores the powerful influence of social determinants of health, the conditions in which people are born, grow, live, work, and age. These factors, often beyond individual control, play a significant role in shaping health outcomes. To truly understand health inequalities, we must move beyond simplistic narratives and delve into the complex interplay of personal choice and social circumstance. Beyond choice, smoking, deprivation, and the cycle of inequality. Let's take smoking as a prime example. Smoking rates are undeniably higher among those living in poverty. While some may attribute this to a lack of willpower or poor choices, the reality is far more nuanced. Decades of research have shown a strong correlation between deprivation and smoking. People living in poverty face a multitude of stressors: financial insecurity, inadequate housing, and limited access to health care, to name a few. In these environments, smoking often becomes a coping mechanism, a way to alleviate stress and find a moment of solace in challenging circumstances. Moreover, the pervasive marketing of tobacco products in deprived neighborhoods perpetuates a cycle of addiction, disproportionately impacting the most vulnerable members of our society. Therefore, attributing smoking solely to personal choice ignores the powerful social and economic forces at play. It is not merely a matter of willpower, but a complex interplay of social determinants that influences this harmful habit. To effectively address smoking-related health inequalities, we must acknowledge the influence of these external factors. A tale of two perspectives: individual responsibility versus social determinants. The issue of health inequalities often sparks heated debate, with opinions sharply divided between individual responsibility and the role of social determinants. On one hand, proponents of individual responsibility argue that everyone has the power to make healthy choices, regardless of their circumstances. They emphasize the importance of personal accountability in maintaining good health, advocating for education and awareness campaigns to empower individuals to make better decisions. Conversely, those who emphasize social determinants argue that individual choices are often constrained by factors beyond one's control. They point to the overwhelming evidence demonstrating how poverty, lack of education, and inadequate access to healthcare create significant barriers to healthy living. This perspective advocates for policy interventions and social programs aimed at addressing these systemic issues to create a more equitable playing field for all. While both sides present valid points, the reality is far more nuanced than either extreme. It is not a matter of choosing one perspective over the other, but rather recognizing the complex interplay between individual agency and social structures. Section 4. Stress, social networks, and the comfort of familiar habits.